Silent kidney threat. The 12 most dangerous medications you're taking. Our kidneys play a vital role in filtering waste and maintaining fluid balance in the body, yet they are often vulnerable to damage from various substances. Among these, certain medications pose a silent threat to kidney health, potentially leading to serious complications if not managed properly. In this video, we will explore 12 common drugs that can be harmful to your kidneys. Understanding the risks associated with these medications is crucial for safeguarding your kidney function and making informed choices about your treatment options. By staying aware and consulting with healthcare professionals, you can better protect your kidneys while managing your health. 1. Antibiotics. Antibiotics are widely used to treat bacterial infections, but they can also have significant side effects, including potential harm to the kidneys. Understanding the risks associated with antibiotic use and taking preventive measures can help protect kidney health. How antibiotics affect the kidneys. 1. Nephrotoxicity. Some antibiotics are nephrotoxic, meaning they can cause direct damage to the kidneys. This damage can occur through various mechanisms, such as causing inflammation, disrupting kidney cell function, or inducing oxidative stress. 2. Impaired kidney function. Antibiotics can impair kidney function by reducing the kidney's ability to filter waste and excess fluids from the blood. This can lead to a buildup of toxins in the body and potentially cause acute kidney injury, AKI, or chronic kidney disease. 3. Allergic reactions. Some individuals may have allergic reactions to certain antibiotics, which can cause inflammation and damage to the kidneys. These reactions can range from mild to severe and require immediate medical attention. Common antibiotics that can harm the kidneys. 1. Aminoglycosides. Drugs like gentamicin and tobramycin are potent antibiotics used to treat serious infections. However, they are known for their nephrotoxic effects, especially with prolonged use or high doses. 2. Vancomycin. Used to treat severe infections caused by resistant bacteria, vancomycin can also cause kidney damage, particularly when used in combination with other nephrotoxic drugs. 3. Cephalosporins. While generally safer than aminoglycosides, some cephalosporins, like cephalexin and ceftriaxone, can cause kidney issues, particularly in individuals with pre-existing kidney conditions. 4. Sulfonamides. Antibiotics like sulfamethoxazole can cause crystal formation in the kidneys, leading to blockage and damage, especially if adequate hydration is not maintained. 5. Fluoroquinolones. Drugs like ciprofloxacin and levofloxacin are effective against a variety of infections but can cause kidney damage in some individuals. 6. Penicillins. Although less common, some penicillin antibiotics can cause interstitial nephritis, an inflammatory condition of the kidneys. While antibiotics are essential for treating bacterial infections, they can pose risks to kidney health, particularly with certain types and prolonged use. Being aware of the potential nephrotoxic effects of antibiotics, staying hydrated, monitoring kidney function, and communicating with your healthcare provider can help mitigate these risks and protect your kidneys. By taking these precautions, you can ensure that antibiotics are used safely and effectively without compromising your kidney health. 2. Diuretics. Diuretics, often referred to as water pills, are commonly prescribed medications used to treat a variety of conditions, including high blood pressure, heart failure, and edema, swelling. While diuretics are effective for managing these conditions, they can also have potential harmful effects on the kidneys if not used properly. Diuretics work by increasing the amount of urine produced by the kidneys. This helps to remove excess fluid and salt from the body, which can reduce blood pressure and decrease swelling. There are several types of diuretics, including 1. Thiazide diuretics, commonly prescribed for high blood pressure and mild fluid retention. Examples include hydrochlorothiazide and chlorthalidone. 2. Loop diuretics. More potent diuretics used for severe fluid retention, often in conditions like heart failure. Examples include furosemide, Lasix, and bumetanide. 3. Potassium-sparing diuretics. These help to prevent the loss of potassium, a vital mineral that is often depleted with other types of diuretics. Examples include spironolactone and amiloride. How diuretics can harm your kidneys. 1. Dehydration. Diuretics increase urine production, which can lead to dehydration if fluid intake is not adequately maintained. Dehydration can reduce kidney function and lead to acute kidney injury. 2. Electrolyte imbalances. Diuretics can cause imbalances in essential electrolytes, such as potassium, sodium, and magnesium. These imbalances can impair kidney function and lead to complications like muscle cramps, weakness, and heart arrhythmias. 3. Reduced blood flow to the kidneys. By lowering blood pressure, diuretics can reduce blood flow to the kidneys. This can be particularly problematic in individuals with existing kidney issues or those taking other medications that affect kidney function. 4. Increased risk of kidney stones. Some diuretics, especially loop diuretics, can increase the concentration of calcium in the urine, leading to the formation of kidney stones. 5. Chronic kidney disease. Long-term use of diuretics, especially at high doses, can contribute to the development or worsening of chronic kidney disease. Monitoring kidney function regularly is crucial for individuals on long-term diuretic therapy. Diuretics are commonly used medications that can effectively manage conditions like high blood pressure and heart failure. However, they can also pose risks to kidney health if not used properly. By understanding the potential harmful effects of diuretics on the kidneys and taking proactive measures to monitor and manage these risks, individuals can maintain better overall health and reduce the likelihood of kidney damage. 3. Nonsteroidal anti-inflammatory drugs, NSAIDs. Nonsteroidal anti-inflammatory drugs, NSAIDs, are widely used medications for managing pain, inflammation, and fever. Common NSAIDs include ibuprofen, naproxen, and aspirin. While effective for short-term relief of various symptoms, prolonged or excessive use of NSAIDs can have detrimental effects on kidney health. How NSAIDs affect the kidneys. 1. Reduced blood flow to the kidneys. NSAIDs work by inhibiting the production of prostaglandins, which are chemicals involved in inflammation and pain. Prostaglandins also play a crucial role in maintaining adequate blood flow to the kidneys. By blocking these chemicals, NSAIDs can reduce blood flow to the kidneys, impairing their function and leading to potential damage. 2. Increased risk of acute kidney injury. Prolonged or high-dose use of NSAIDs can lead to acute kidney injury, AKI, a condition characterized by a sudden decline in kidney function. Symptoms of AKI may include reduced urine output, fluid retention, and electrolyte imbalances. AKI can be serious and may require hospitalization or dialysis in severe cases. 3. Chronic kidney disease. Long-term use of NSAIDs, especially in individuals with pre-existing kidney conditions or those taking multiple medications, can contribute to the development or progression of chronic kidney disease. CKD is a gradual loss of kidney function over time, which can eventually lead to kidney failure if not managed properly. 4. Electrolyte imbalances. NSAIDs can affect the balance of electrolytes in the body, including sodium, potassium, and calcium. Disruptions in electrolyte balance can have adverse effects on kidney function and overall health. 5. Fluid retention and high blood pressure. NSAIDs can cause fluid retention and increase blood pressure, which can put additional strain on the kidneys. Chronic high blood pressure is a known risk factor for kidney damage and CKD. Nonsteroidal anti-inflammatory drugs, NSAIDs, are effective for managing pain and inflammation but can pose risks to kidney health, particularly with prolonged or excessive use. Understanding these risks and taking precautions can help mitigate potential damage. If you have concerns about NSAID use and its effects on your kidneys, consult with a healthcare provider for personalized advice and alternative treatment options. 4. Proton pump inhibitors, PPIs. Proton pump inhibitors are a class of medications commonly used to treat conditions related to excess stomach acid, such as gastroesophageal reflux disease, GERD, peptic ulcers, and Zollinger-Ellison syndrome. While these medications are effective at reducing acid production and alleviating symptoms, long-term use of PPIs has been associated with potential risks to kidney health. How proton pump inhibitors work. PPIs work by blocking the proton pumps in the stomach lining that are responsible for producing stomach acid. This results in decreased acid secretion, providing relief from symptoms associated with acid reflux and ulcers. Commonly prescribed PPIs include omeprazole, Prilosec, esomeprazole, Nexium, lansoprazole, Prevacid, pantoprazole, Protonix, rabeprazole, Acifex. Potential impact of PPIs on kidney health. 1. Chronic kidney disease. Several studies have suggested that long-term use of PPIs may increase the risk of developing chronic kidney disease. The mechanism behind this association is not fully understood but may involve the impact of PPIs on kidney function and the potential for kidney damage over time. 2. Acute kidney injury, AKI. PPIs have been linked to an increased risk of acute kidney injury, a sudden and severe decline in kidney function. AKI can result from various factors, including decreased blood flow to the kidneys, inflammation, or allergic reactions. 3. Kidney stones. Some research suggests that PPIs may increase the risk of developing kidney stones. This is thought to be due to alterations in urine composition caused by reduced stomach acid, which can affect calcium absorption and excretion. 4. Electrolyte imbalance. Prolonged use of PPIs can lead to imbalances in important electrolytes such as magnesium and calcium. These imbalances can contribute to kidney issues and other health problems. While proton pump inhibitors are effective for managing conditions related to excess stomach acid, long-term use may pose risks to kidney health. By understanding these potential risks and working closely with your healthcare provider, you can manage your medication regimen safely and take proactive steps to protect your kidney health. 5. Laxatives. Laxatives are commonly used to relieve constipation and promote bowel movements. While they can be effective for managing short-term digestive issues, the misuse or overuse of laxatives can pose significant risks to kidney health. Understanding these risks is crucial for maintaining overall well-being and preventing potential kidney damage. How laxatives affect kidney health. 1. Electrolyte imbalance. Many types of laxatives, especially stimulant and osmotic laxatives, can lead to significant electrolyte imbalances. These imbalances occur because laxatives increase the frequency of bowel movements, causing the body to lose essential electrolytes such as potassium, sodium, and magnesium. Electrolyte imbalances constrain the kidneys, which are responsible for regulating these minerals and maintaining fluid balance. 2. Dehydration. Laxatives can increase the risk of dehydration by causing excessive fluid loss through frequent bowel movements. Dehydration can decrease blood flow to the kidneys and impair their ability to filter waste and maintain fluid balance effectively. Prolonged dehydration can lead to acute kidney injury and chronic kidney disease. 3. Kidney function impairment. Chronic use of laxatives, particularly in high doses, can lead to long-term kidney function impairment. Persistent dehydration and electrolyte disturbances can damage the kidney's filtering capabilities, potentially resulting in kidney damage or worsening pre-existing kidney conditions. 4. Risk of acute kidney injury. In severe cases, excessive use of laxatives can lead to acute kidney injury, AKI. AKI is a sudden decline in kidney function, often caused by a combination of dehydration, electrolyte imbalances, and reduced blood flow to the kidneys. Symptoms of AKI may include decreased urine output, swelling, and confusion. 5. Underlying health conditions. Individuals with pre-existing kidney conditions or other health issues may be at a higher risk of experiencing adverse effects from laxative use. It's essential for such individuals to use laxatives cautiously and under the guidance of a healthcare professional. Types of laxatives and their risks. 1. Stimulant laxatives. These increase bowel movement by stimulating the intestinal lining. Common examples include bisacodyl, Dulcolax, and Senna, Senocot. Overuse can lead to dehydration and electrolyte imbalances. 2. Osmotic laxatives. These work by drawing water into the intestines to soften stools. Examples include polyethylene glycol, Miralax, and lactulose. Prolonged use can disrupt fluid and electrolyte balance. 3. Saline laxatives. These increase bowel movements by drawing water into the intestines through salt. Magnesium citrate and magnesium hydroxide, milk of magnesia, are common examples. They can cause significant electrolyte imbalances and dehydration if used excessively. 4. Bulk-forming laxatives. These add bulk to the stool, promoting regular bowel movements. Examples include psyllium, metamucil, and methylcellulose, Citracel. While generally safer, excessive use without adequate fluid intake can still pose risks. While laxatives can be effective for relieving constipation, their potential impact on kidney health should not be overlooked. Misuse or overuse of laxatives can lead to electrolyte imbalances, dehydration, and kidney damage. By using laxatives responsibly, staying hydrated, and consulting healthcare professionals, individuals can mitigate these risks and protect their kidney health. 6. Antidepressants. Antidepressants are widely prescribed to manage conditions such as depression, anxiety, and other mood disorders. While these medications are effective in improving mental health, some can potentially have adverse effects on kidney function. It is important for patients to be aware of these risks and for healthcare providers to monitor kidney health during treatment. Types of antidepressants and their potential impact on kidneys. 1. Selective serotonin reuptake inhibitors, SSRIs. Examples: fluoxetine, Prozac, sertraline, Zoloft, escitalopram, Lexapro. Potential impact. SSRIs are generally considered safe for kidney function in the short term. However, long-term use or high doses can sometimes lead to kidney issues, particularly in individuals with pre-existing kidney conditions. SSRIs may cause fluid retention or electrolyte imbalances, which can indirectly affect kidney function. 2. Serotonin norepinephrine reuptake inhibitors, SNRIs. Examples: venlafaxine, Effexor, duloxetine, Cymbalta. Potential impact. SNRIs can be associated with increased blood pressure, which may affect kidney function over time. Additionally, these medications may cause dehydration or fluid imbalances, potentially putting additional strain on the kidneys. 3. Tricyclic antidepressants, TCAs. Examples: amitriptyline, nortriptyline, Pamelor, imipramine, Tofranil. Potential impact. TCAs are known to have anticholinergic effects, which can lead to urinary retention and other bladder issues. These effects may cause secondary problems for kidney function, particularly if the urinary tract is obstructed or compromised. 4. Monoamine oxidase inhibitors, MAOIs. Examples: phenelzine, nardial, tranylcypromine, parnate. Potential impact. MAOIs can interact with certain foods and medications, potentially causing a hypertensive crisis. This crisis can lead to complications such as dehydration, which can adversely affect kidney function. Mechanisms of kidney damage. 1. Electrolyte imbalances. Some antidepressants can disrupt electrolyte levels, leading to conditions like hyponatremia, low sodium levels, or hyperkalemia, high potassium levels. These imbalances can affect kidney function and overall fluid balance in the body. 2. Dehydration. Certain antidepressants may cause dehydration by increasing urine output or causing fluid retention issues. Dehydration puts additional stress on the kidneys and can lead to acute kidney injury if not properly managed. 3. Blood pressure changes. Some antidepressants, particularly SNRIs, can raise blood pressure. High blood pressure is a known risk factor for kidney disease and can exacerbate existing kidney problems. 4. Drug interactions. Antidepressants can interact with other medications, leading to adverse effects on kidney function. For example, combining antidepressants with nonsteroidal anti-inflammatory drugs, NSAIDs, can increase the risk of kidney damage. While antidepressants are effective in treating mood disorders, it is important to be aware of their potential impact on kidney health. Regular monitoring, appropriate dosage adjustments, and maintaining overall health can help mitigate the risks. Patients should work closely with their healthcare providers to ensure that their treatment plan is safe and effective, considering both mental and kidney health. 7. Blood pressure medications. Blood pressure medications are often prescribed to manage hypertension and reduce the risk of cardiovascular diseases. However, certain types of these medications can potentially affect kidney function, particularly if not used correctly or if there are pre-existing kidney conditions. Types of blood pressure medications. 1. ACE inhibitors, angiotensin-converting enzyme inhibitors. Examples: enalapril, lisinopril, ramipril. Mechanism. ACE inhibitors help relax blood vessels by blocking the formation of angiotensin II, a hormone that constricts blood vessels. Potential kidney impact. While generally beneficial for heart health, ACE inhibitors can affect kidney function by reducing blood flow to the kidneys. This can lead to elevated levels of potassium and worsening of kidney function, especially in individuals with pre-existing kidney disease or those taking other medications that affect kidney function. 2. ARBs, angiotensin II receptor blockers. Examples: losartan, valsartan, irbesartan. Mechanism. ARBs work by blocking the action of angiotensin II on blood vessels, leading to their dilation and reduced blood pressure. Potential kidney impact. Similar to ACE inhibitors, ARBs can impact kidney function by altering blood flow. They are often used as an alternative to ACE inhibitors and may have a similar risk of increasing potassium levels and affecting renal function. 3. Beta blockers. Examples: metoprolol, atenolol, carvedilol. Mechanism. Beta blockers reduce blood pressure by blocking the effects of adrenaline, leading to a slower heart rate and reduced force of heart contractions. Potential kidney impact. Beta blockers generally have a less direct impact on kidney function compared to ACE inhibitors and ARBs. However, they may contribute to fluid retention and affect kidney function indirectly, particularly in combination with other medications that impact renal health. 4. Calcium channel blockers. Examples: amlodipine, diltiazem, verapamil. Mechanism. These medications relax blood vessels and reduce blood pressure by blocking calcium from entering cells in the heart and blood vessel walls. Potential kidney impact. Calcium channel blockers are less likely to directly impact kidney function, but they can contribute to fluid retention and may need to be used cautiously in individuals with pre-existing kidney conditions. While blood pressure medications are essential for managing hypertension and cardiovascular diseases, some can potentially affect kidney function. Understanding the potential risks associated with ACE inhibitors, ARBs, diuretics, beta blockers, and calcium channel blockers can help individuals and healthcare providers work together to monitor and maintain kidney health. Regular testing, proper medication management, and lifestyle adjustments are key to minimizing risks and ensuring effective treatment. 8. Zoledronic acid. Zoledronic acid is a bisphosphonate medication widely used to treat conditions such as osteoporosis, Paget's disease, and bone metastasis associated with cancer. It helps to prevent bone loss and reduce the risk of fractures. However, like many medications, zoledronic acid can pose risks to kidney health, especially when not used appropriately. How zoledronic acid affects the kidneys. 1. Mechanism of action. Zoledronic acid works by inhibiting osteoclast activity, which reduces bone resorption and turnover. While effective for bone health, this mechanism can affect the kidneys because the drug is excreted through the kidneys. 2. Renal toxicity risk. Zoledronic acid can potentially cause renal toxicity, particularly when used at high doses or in patients with pre-existing kidney conditions. The risk of kidney damage is linked to the drug's impact on renal function, including changes in serum creatinine levels and electrolyte imbalances. 3. Dehydration and electrolyte imbalance. The medication can lead to dehydration and electrolyte disturbances. Proper hydration is essential before administration to minimize the risk of kidney damage. Dehydration can impair kidney function and exacerbate any existing renal issues. 4. Pre-existing kidney conditions. Patients with pre-existing renal impairment or chronic kidney disease are at a higher risk of adverse effects from zoledronic acid. The drug's excretion through the kidneys means that impaired renal function can lead to elevated drug levels and increased risk of toxicity. Zoledronic acid is a powerful medication for managing bone-related conditions but carries a risk of kidney damage, particularly in individuals with pre-existing renal conditions or those not adequately hydrated. Monitoring kidney function, ensuring proper hydration, and adjusting dosages as needed can help mitigate these risks. If you have concerns about kidney health while using zoledronic acid, consult with your healthcare provider to discuss the best approach for managing both your bone health and renal function. 9. Immunosuppressant drugs. Immunosuppressant drugs are commonly used to manage various medical conditions, including autoimmune diseases and organ transplants. While these medications are essential for controlling immune responses and preventing organ rejection, they can also pose risks to kidney health. Immunosuppressants work by dampening the immune system's activity to prevent it from attacking the body's own tissues or the transplanted organ. This class of drugs includes several different types, each with its own mechanism of action and potential side effects. Potential kidney risks. 1. Kidney toxicity. Some immunosuppressants, particularly calcineurin inhibitors like cyclosporin and tacrolimus, can directly affect kidney function. These drugs may cause kidney toxicity by constricting blood vessels in the kidneys, leading to reduced blood flow and impaired kidney function. 2. Increased risk of infection. Immunosuppressants can weaken the immune system, making the body more susceptible to infections. Kidney infections or urinary tract infections, UTIs, can become more frequent or severe in patients taking these medications, potentially leading to kidney damage if not treated promptly. 3. Electrolyte imbalance. Certain immunosuppressants can affect electrolyte balance in the body. For instance, drugs like cyclosporin may lead to hyperkalemia, high potassium levels, which can be harmful to the kidneys and overall health. 4. High blood pressure. Some immunosuppressants can raise blood pressure, a condition known as hypertension. Chronic hypertension can strain the kidneys and increase the risk of kidney disease or worsen pre-existing kidney conditions. 5. Chronic kidney disease. Long-term use of immunosuppressants, especially in high doses, can contribute to the development of chronic kidney disease. This condition is characterized by a gradual decline in kidney function over time, which can progress to end-stage renal disease if not managed properly. Immunosuppressant drugs are crucial for managing autoimmune diseases and preventing organ rejection, but they can potentially harm kidney health. By understanding the risks and implementing effective monitoring and management strategies, patients can minimize the impact of these medications on their kidneys. Regular medical checkups and proactive management are key to maintaining kidney function and overall health while on immunosuppressant therapy. 10. Dietary supplements. Dietary supplements are widely used to support health and wellness, but not all supplements are harmless. Some can have adverse effects on kidney function, especially when taken in excess or without proper medical supervision. Understanding the potential risks associated with certain supplements can help you make informed choices and protect your kidney health. How dietary supplements affect kidney health. 1. Excessive dosage. Taking high doses of certain dietary supplements can put a strain on the kidneys. The kidneys are responsible for filtering and excreting waste products, including those from supplements. Overloading the kidneys with excessive amounts of certain nutrients or compounds can impair their function over time. 2. Kidney toxicity. Some supplements contain ingredients that can be toxic to the kidneys. These can cause direct damage or exacerbate pre-existing kidney conditions. 3. Interactions with medications. Dietary supplements can interact with prescription medications, potentially leading to increased strain on the kidneys or affecting their ability to filter blood properly. Specific dietary supplements that may harm the kidneys. 1. Vitamin D. While vitamin D is essential for bone health and overall wellness, excessive intake can lead to hypercalcemia, high levels of calcium in the blood. Hypercalcemia can cause kidney stones and damage to kidney tissues. It is important to use vitamin D supplements under medical supervision to avoid overconsumption. 2. Vitamin C. High doses of vitamin C can increase the risk of developing kidney stones, particularly in individuals who are predisposed to this condition. The body converts excess vitamin C into oxalate, which can form stones in the kidneys. 3. Creatine. Commonly used by athletes and bodybuilders to enhance performance, creatine can increase the workload on the kidneys. Long-term or high-dose use may lead to kidney damage, especially in individuals with pre-existing kidney conditions. 4. Herbal supplements. Certain herbs, such as ephedra, ma huang, aristolochia, and certain weight loss supplements, have been linked to kidney damage. These herbs can cause direct toxicity or interfere with normal kidney function. 5. Calcium supplements. While calcium is crucial for bone health, excessive intake from supplements can lead to hypercalcemia and increase the risk of kidney stones and impaired kidney function. It's important to balance calcium intake with dietary sources and avoid high-dose supplements unless prescribed by a healthcare provider. 6. Green tea extract. High doses of green tea extract, especially in supplement form, can cause liver and kidney toxicity. It is advisable to use these supplements in moderation and consult a healthcare professional. 7. Ginseng. While ginseng is used for its various health benefits, high doses can potentially impact kidney function. It is recommended to use ginseng supplements under the guidance of a healthcare provider. While dietary supplements can provide various health benefits, some may pose risks to kidney health, especially when taken in excess or without medical supervision. Being aware of the potential dangers and using supplements responsibly can help protect your kidneys and overall well-being. Always consult with a healthcare provider before starting any new supplement regimen and prioritize safety to maintain optimal kidney function. 11. Cholesterol-lowering medications. Cholesterol-lowering medications, particularly statins, are commonly prescribed to manage high cholesterol levels and reduce the risk of cardiovascular disease. While these medications are effective in improving heart health, they can have potential side effects, including adverse effects on kidney function. It is important to understand these risks and monitor kidney health while using these medications. Types of cholesterol-lowering medications. 1. Statins. The most widely prescribed cholesterol-lowering drugs, such as atorvastatin, simvastatin, and rosuvastatin, work by inhibiting an enzyme, HMG-CoA reductase, involved in cholesterol production in the liver. This results in lower levels of LDL, bad cholesterol, in the blood. 2. Ezetimibe. This medication works by reducing the absorption of cholesterol from the diet in the intestines. It is often used in combination with statins. 3. PCSK9 inhibitors. These include medications like alirocumab and evolocumab, which lower LDL cholesterol levels by enhancing the liver's ability to remove LDL cholesterol from the blood. 4. Bile acid sequestrants. Drugs like cholestyramine and cholestyramine bind bile acids in the intestine, preventing their reabsorption and reducing cholesterol levels. Potential risks to kidney health. 1. Statin-induced kidney damage. Although rare, statins can cause muscle damage, rhabdomyolysis, which may lead to kidney injury. Rhabdomyolysis results in the release of muscle breakdown products, such as myoglobin, into the bloodstream, which can damage the kidneys. Symptoms. Signs of statin-induced kidney damage may include dark-colored urine, muscle pain or weakness, and fatigue. 2. Elevated creatinine levels. Some cholesterol-lowering medications, especially statins, can lead to a temporary increase in serum creatinine levels, a marker of kidney function. This can indicate impaired kidney function, although it is usually reversible with dose adjustments or discontinuation of the medication. 3. Interaction with other medications. Cholesterol-lowering drugs may interact with other medications that affect kidney function, amplifying the risk of renal impairment. For example, combining statins with certain antibiotics or antifungal medications can increase the risk of kidney damage. 4. Dehydration and kidney stress. Cholesterol medications can sometimes contribute to dehydration, particularly if used in conjunction with diuretics, water pills. Dehydration can put additional stress on the kidneys, potentially leading to reduced kidney function. Cholesterol-lowering medications, particularly statins, can have potential side effects that impact kidney health. While the risk is relatively low, it is essential for patients to be aware of these potential issues and to undergo regular monitoring of kidney function. By working closely with healthcare providers, individuals can manage their cholesterol levels effectively while minimizing risks to their kidney health. 12. Medications control blood sugar levels. Diabetes management often involves medications to help control blood sugar levels. While these medications are essential for managing diabetes and preventing complications, some can have potential side effects on the kidneys. Understanding these risks is important for maintaining kidney health while managing diabetes. Types of diabetes medications and their impact on kidney health. 1. SGLT2 inhibitors, sodium glucose cotransporter 2 inhibitors. Examples: canagliflozin, Invokana, dapagliflozin, Farxiga, empagliflozin, Jardiance. Impact. These medications work by preventing glucose reabsorption in the kidneys, which helps lower blood sugar levels. While generally beneficial for blood sugar control and potentially reducing the risk of heart failure, they can sometimes lead to dehydration, urinary tract infections, and an increased risk of diabetic ketoacidosis, which can indirectly stress the kidneys. 2. Metformin. Brand names: Glucophage, Glucophage XR, Riomet, Impact. Metformin is one of the most commonly prescribed medications for type 2 diabetes. While it is generally considered safe for the kidneys, in cases of severe kidney impairment, it can lead to a rare but serious condition known as lactic acidosis. This condition is associated with the accumulation of lactic acid in the blood, which can be dangerous if kidney function is compromised. 3. Sulfonylureas. Examples: glipizide, glucotrol, glyburide, diabeta, glimepiride, Amaryl. Impact. Sulfonylureas stimulate the pancreas to produce more insulin. While effective in lowering blood sugar, they can sometimes cause hypoglycemia, low blood sugar, which may lead to kidney strain if severe or prolonged. Additionally, some of these medications are excreted through the kidneys, and impaired kidney function can lead to increased drug levels and potential toxicity. 4. Thiazolidinediones, TZDs. Examples: pioglitazone, Actos, rosiglitazone, Avandia, Impact. TZDs work by increasing insulin sensitivity in muscle and fat tissues. These medications can cause fluid retention and weight gain, which may exacerbate heart failure and potentially impact kidney function over time. Monitoring kidney function is important when using TZDs, especially in patients with pre-existing kidney issues. 5. Insulin. Examples: insulin glargine, Lantus, insulin Lispro, Humalog, insulin Aspart, Novolog. Impact. Insulin itself does not directly harm the kidneys, but improper dosing or uncontrolled diabetes can lead to complications that affect kidney function. Additionally, insulin is metabolized by the liver, but its effects on blood glucose levels can indirectly impact kidney health. While diabetes medications are essential for managing blood sugar levels, some can pose risks to kidney health. By understanding the potential impacts and taking proactive measures such as regular monitoring and lifestyle adjustments, individuals can manage diabetes effectively while protecting their kidneys. Collaborating with healthcare providers ensures that treatment plans are safe and tailored to individual health needs. Being aware of the potential risks associated with common medications is essential for maintaining kidney health. The 12 drugs highlighted in this video can have detrimental effects on your kidneys, often without immediate symptoms. By understanding these risks and discussing alternatives with your healthcare provider, you can take proactive steps to protect your kidney function. Always consult with a medical professional before making changes to your medication regimen and monitor your health regularly. Prioritizing kidney health is crucial for overall well-being and long-term vitality. Thank you for watching our video. We hope you found the information valuable and insightful. If you did, please give it a thumbs up, share it with others, and subscribe for more content. We'd love to hear your thoughts or any questions you have in the comments below. Stay informed and take care of your health. See you next time.